Thank you so much. Adolescent counseling is an integral and very important part of adolescent medicine practice. And I appreciate that West Bengal Adolescent Health Academy, in their inaugural program, and Central AHA in their inaugural program in 2024, have thought about this topic, basics of adolescent counseling, to kickstart the academic activities. And it is indeed an honor and privilege for me to be here with you today. I would, at the outset, acknowledge IAP-AHA Adolescent Counseling Program, the Presidential Action Plan 2022, because most of the slides during my presentation are taken from this program. Counseling in adolescence is extremely important. Why is it so? This is because we all know that adolescent is one of the most rapid periods of biopsychosocial development, and not all adolescents can cope with these changes in a similar way. Also, we are very familiar with the emotional reactivity that occurs in the adolescent age group, the highly reactive limbic system, also the reward system, and immature prefrontal cortex. So adolescents are vulnerable to sensation seeking and at-risk behavior. Also, the stress response in this period is immature. So almost all adolescents need a guiding hand. And who better than a pediatrician who has a fantastic rapport with not only the adolescent, but also with the family since the newborn period and beyond. And in fact, in India, there's a 75% shortage of mental health professionals, and definitely pediatricians need to pitch in with counseling and mental health care in this scenario. Adolescents, and more so their parents, come to us for counseling on various issues, most commonly scholastic problems, conflicts with parents, behavior issues like anger, aggression, violence, excessive media use, peer affiliation, eating disorders are some of the problems that we see in clinical practice. But adolescents themselves are not very keen to come to us because they feel that the medical services are unfriendly and they fear reprimand and rebuke from even the health professionals. Hence, as a professional organization, it is essential to actually reach them at their own wavelength. And hence, we all need to learn the art and science of counseling to understand the definition, aims, skills, ethics, process, and errors in counseling, and to imbibe these skills. Because we also know that adolescence is a period of opportunity, and the brain connections which are formed now, healthy lifestyle which is adopted now, coping skills which are adopted now, which actually last a full lifetime. So, what is counseling? It is a process by which a trained professional helps the clients to identify their problems, which may be in different domains: personal, social, or psychological, to brainstorm solutions for these problems, make decisions according to the client's psychosocial, spiritual, and financial needs, and implement the decisions made by the client confidently. So remember, it is the choice of the client and not your choice. For example, an adolescent, a 15-year-old who comes to you for counseling because the parents have suspect that she drinks alcohol, after your counseling session tells you that she will continue to drink alcohol in a social gathering, you need not be put off. What you need to ensure here is harm reduction. You can talk to her about not driving any vehicle under influence of alcohol, or being driven by any friend or peer under the influence of alcohol. So sometimes with counseling, we may not be able to eliminate harm, but harm reduction is a good enough goal. You keep the doors and windows of your clinic open and eventually aim for abstinence, which would come gradually with counseling, provided the adolescent comes back to you. Yes, so the aims of counseling are to assess the situation and choose the option best suited for self and others, to become self sufficient, self dependent, and self directed for a meaningful and fulfilling life, to make a voluntary change for improving personal effectiveness, either by facilitating behavior change or enhancing coping skills, and for improving relationships. Now, there are different types of counseling. Counseling can be given in an individual format or in a group format or even in telecounseling mode. But we have to remember that we need to follow the Government of India guidelines for telecounseling while imparting this mode. Counseling can be given for educational purposes, study skills, for career counseling, for following a healthy lifestyle, to overcome mental distress, substance use, grief, relationship, for trauma informed care, especially in cases of sexual abuse or children facing, adolescents facing adverse childhood experiences, premarital, family, marriage counseling for young adults, genetic counseling, rehabilitation for special needs, addictions, and for medical disorders. We are not going to go into the details of these types of counseling, but we are just going to touch upon the general principles. Now, there's often confusion about guidance, counseling, and psychotherapy. Let me explain this to you with an example. So, you have an adolescent coming to you, and as a part of anticipatory guidance, you tell them how to make healthy choices regarding nutrition, especially when there are so available regarding the various diets. Now, when this adolescent gets very concerned about his body image and starts skipping meals and reduces the caloric intake, this adolescent is under distress and would require counseling. Starts body image, also starts vomiting after eating, is a mental disorder and would need psychotherapy. So you can see how guidance, counseling, psychotherapy can be used under different circumstances to actually help the adolescent. So before we talk about what is counseling, let's be very clear what is not counseling. Let me come back to the case of this adolescent girl who takes alcohol. And as soon as she enters and you get to know that she drinks alcohol, you think, oh, she's a terrible person. She's a bad girl. She has loose morale. And actually, you tell her, hey, you belong to a very good family. You should not be drinking alcohol because alcohol makes you a
Madam,
bad
Dr.
person.
Maya, please mute it. It's disturbing. Dr. Maya, please mute it.
তোর হাতে ভীষণ ঠান্ডা হয়েছে, হাতটা পকেটে ঢুয়ে রাখ।
Sharma
তুই
sir,
আবার
you can
টেনে
mute
দিচ্ছিস নাকি?
everyone. Please, Sharma sir.
Thank you, Maya. And again, you go about telling her that it is not according to your religious values, you should not be smoking or you should not be drinking. And then you tell her, please stop drinking alcohol immediately. The moment you speak like this, in fact, you break the therapeutic alliance. The adolescent will not listen to you and would not like to come to you for follow-up sessions and may even walk out straight away. When you're talking to this adolescent, if you tell, oh, you're having stress, you need to overcome this stress not by alcohol, but other means, I will help you with whatever you need. And do you also smoke? Are you also having many girlfriends or boyfriends? And whenever you have a problem, you can come to me. So giving solutions to problem, unwanted reassurance, excessive interrogation, encouraging dependence are all harakiri to therapeutic alliance. And this is what we need to absolutely avoid. Now, what are the attributes and skills of counselor? I suggest you keep this checklist with you and keep ticking. The counselor should be trained, well adjusted, with good emotional control himself or herself, should definitely understand adolescent growth and development, should have a genuine interest in adolescents and their families, should be open-minded, flexible, and offer confidentiality within limits. And this triad is extremely important. The counselor should be empathetic. And what is empathy? Empathy is understanding the other person's perspective and conveying the same to the client. It is often said, getting into the other person's shoes without removing the socks. The counselor should be congruent. That is, for example, I say, you can share with me whatever you want. Please feel at ease in sharing with me. And I keep looking at my watch. That means I'm having an incongruent behavior. Actually, I don't have time to talk to the adolescent. Unconditional positive regard is something called as non-judgmental attitude that we have. So, like I said before, an adolescent using alcohol or in any other behavior, whatever may be the attitude, you have a total acceptance for your client and you give him the same kind of respect. Coming back to confidentiality, the law says that personal health information should be kept confidential, except in cases of sexual abuse, suicidal harm, crime, medical legal case, and hospitalization. So as counselors, we should be aware about it. We should express these limits before starting the counseling session. And in case if these conditions are present, we need to break confidentiality, very sensitivity, with a lot of sensitivity and empathy, and break confidentiality to a person that the adolescent chooses and trusts. The other attributes and skills of counselor are leading. We have to actually lead the client. Okay, so an adolescent who gets anger issues with his father, what happens when you look at your father? Oh, doctor, when I look at my father, I remember how he beat me up as a child. I feel so terrible and I feel like screaming at him. So you lead him from thoughts, feeling, behavior, and how to deal with those thoughts. Self-disclosure. Yes, if somebody beats you, even I feel very scared to look at another person who has beaten me before. So as a counselor, you can disclose your own feelings, but remember, the focus is not you. It is your client. So after disclosing, you immediately move on to the client's issues. Immediacy. You give him an environment to the client which has adequate visual privacy and also auditory privacy is extremely important. Use humor carefully, not to hurt the client, but to lighten the atmosphere. Sometimes there's a phenomenon of transference which occurs. Suddenly the client would feel and they would express their emotions as if you are their parent. This is in one way good, because then you understand what exactly the client feels about his or her parent, but guard yourself against counter transference. There may be feelings of love and affection which may be inappropriate to the counselor-counselee relationship which may develop, and then the counselor himself or herself needs help. Counselors should also overcome barriers of emotional, physical, language, cultural, financial, and most important, time constraints. Each counseling session requires at least 40 to 50 minutes, nothing less than that. Counselors should follow ethics of beneficence, non-maleficence, justice, equity, and should not violate boundaries. They should ensure self-care, ventilation, and debriefing, and they should take care of their emotional health by always talking to a colleague or a senior, especially about difficult cases, and of course should have effective communication skills. What do we mean by effective communication skills? We mean that a counselor should take consent, ensure privacy, confidentiality, and have a respectful communication. These skills can be divided into verbal and non-verbal. Verbal include keep it short and simple, the KISS principle, without using scientific jargon. Use apt words, tone, and pitch. Open-ended questions. Is your relationship with your father good? Is a closed-ended question. How is your relationship with your father? Is an open-ended, which would stimulate the adolescent to share much more with you. Active listening. What does that mean? Paying attention, minimal response. Oh, really? Then, and reflecting emotions and words. So when your teacher screams at you, you feel terrible. And when your friends make fun of you, you feel terrible too. And the adolescent says, no, my teacher screaming is okay once in a while, but my friends, when they make fun of me, I feel almost devastated. So then you come to know what is really the concern of the adolescent. Also remember to summarize in the end while you're doing active listening. Praise, validate emotions, empathize, address concerns, reassure, build hope, be non-judgmental. What about non-verbal? Your eye contact, your proximity at the same level, facial expressions, nodding, an open attitude, position of hands and legs are extremely important to motivate the adolescent to share with you. Silence is a fantastic communication technique, especially when there is crowding of emotions. Let the adolescent keep quiet for some time. Let them resolve their emotions. You could even hold hands and pat at that particular time, but be careful and make sure that your contact with the adolescent is not seemed inappropriate. Of course, always listen more and talk less. I have this picture for you, and you can see for yourself that in the figure number 2, it's a more open position of the counselor and the adolescent is speaking freely. While in the figure number 1, there is an authoritarian position. The adolescent is in fact squirming and not at all comfortable. So this tells you how the non-verbal communication should be. So what are the steps? Sometimes all these steps need to be done in just one counseling session, but sometimes you need more time, and each session may require 2 to 3 sessions. But remember, whatever may be the process, always acknowledge, validate feelings, offer support, address concerns, reassure, and build hope. This is extremely important on a one-to-one basis. So the first step is rapport building. This can start with an introduction. You can also play some simple game with the adolescent. My second step is listening to concerns, head psychosocial history taking, assessment of the mental health and the physical well-being, and always rule out referral conditions like psychosis, suicidal behavior, severe substance use disorder, and severe mental disorder. And if you have been counseling before more than 6 weeks, there has been a poor response, please definitely stop your steps and decide to refer in a sensitive and empathetic manner to a mental health professional. As you go ahead with counseling, goal setting has to be done. The adolescent has to prioritize problems and concerns and formulate short and long-term SMART goals. SMART is an acronym which stands for specific, measurable, achievable, realistic, and time-bound. So this adolescent who was taking alcohol said that her short-term goal was to top the class and her long-term goal was to become a scientist. The interventions have to be individualized. Time does not allow me to go into each and every intervention, but let me just give you an idea. Psychoeducation, what worked previously, strength-based and solution-focused counseling, enhancing life skills, motivating for a healthy lifestyle, teaching a few relaxation techniques like mindfulness, or even pursuing a hobby like singing and dancing, correcting maladaptive beliefs, which we'll talk more about in the REBT, sharing information, education, communication material, websites, clarifying queries, giving homework, and follow-up. Always remember to partner with parents and then plan about termination. A word about motivational interviewing. These are the 4 principles. Let me come back to the child who takes alcohol when she is in a peer group. So it's important for you to bind with your peers. I can understand that you want to top your class. Can I share with you what alcohol does to your memory center? So here you have expressed empathy. She wants to top the class. What does alcohol do? You're developing discrepancy and you're trying to support efficacies. Are there any other fun ways of having fun with your friends apart from alcohol? And she says, no, I continue to drink that. So then you roll with the resistance. And like I said before, ensure that she does not drive or be driven again under the influence of alcohol. So these are the principles of motivational interviewing, which are very, very useful in in stimulating the adolescent for a behavior change. Now, the follow-up sessions may start with the icebreaker. You must ask for well-being and concerns, discuss homework, goals and intervention for the session should be clearly charted out. At the end of the session, summarize, give homework, and fix up the next counseling appointment. When do you terminate? You terminate when you feel that the client is confident, empowered, and enabled to deal with life's challenges independently. Short-term goals have been achieved, and you can discuss the roadmap to long-term goals. You must plan for booster sessions. So, for example, if you are seeing once every week, you can slowly increase the gap to maybe once in 2 weeks, and then plan booster session once in 3 months, and also share your contact details. Important to partner with parents, listen to their concerns, psychoeducate them, discuss the assessment and counseling plan, role and responsibilities of the parents and caregivers after seeking adolescents' permission, provide unconditional support, and address their guilt. All the time they are feeling guilty for their adolescents' problems. Educate regarding normative adolescent growth, development, and parenting, and facilitate positive communication. Guide to respond to adolescents' emotional issues calmly and role model apt behavior. Emphasize on self-care, healthy lifestyle, maintaining family routines, ensure follow-up, and also refer them for family therapy or individual therapy depending on the problem of the parents. Let me just end quickly with this case. So Rina mom rings you up and says she has a declining school performance in school tests since past 3 months, and she suspects that her 17-year-old daughter is in a relationship and she wants you to counsel her. So you take a head's history in privacy with confidentiality. She tells you she has recent conflicts with mother. She's concerned with declining scores. She wants to do masters in sports nutrition. She was previously popular among friends, was captain of the basketball team. She is religious, but now she sleeps for only 3 to 4 hours because most of the time she's on the phone with her boyfriend who is forcing her into sexual intercourse, and she is absolutely confused. So what do you do next? You ask her to prioritize her concerns and goals. So she asks you, my first goal is, how do I handle the request of my boyfriend who's forcing me for a physical intimate relationship? How do I improve my academic performance next? And how do I improve my relationship? So what do? You listen in details about her concern. You acknowledge her strengths of parental bonding, sports, life goal, personal value system, and religiosity. You acknowledge the reality of attractions, love, and relationships in life. You talk to her about emotional lability, validate her dilemma, and most important, discuss the effect of her relationship on her life goals, personal values, on her sleep, academics, parents, and even management of time. You give her a healthy relationship checklist and see whether your relationship fits into a healthy relationship. Is your boyfriend respecting personal space, boundaries? Is there mutual respect? Is there consent? Is your relationship mutually enhancing or non-abusive? And then tell her to introspect. How will the relationship affect my life goals and value system? Am I ready for taking the consequences of this relationships? Do I have the emotional maturity? And what are the various ways of expressing sexual intimacy? You go forward and you talk to her about risks and effectiveness of different methods of contraception, pregnancy, abortion, STI, HIV, HPV vaccination, masturbation even. Talk to about healthy media usage, talk to her about POXO, and then discuss the steps of healthy decision-making and effective communication. You summarize and tell her that happy, healthy, safe, and responsible relationships, consent, boundaries, and values are all linked. Do you want me to share something with your parents? Also give her a homework over a few sessions, which would help her to list pros and cons about her relationship, think about safe ways to express intimacy, make a healthy decision, and communicate to her boyfriend, and again reassess her relationship. And you could further teach her study skills and how to manage conflicts. Once again, parental counseling and partnership is extremely important Talk to the parents, including the fathers, about normal adolescent growth and development, how to stay connected, how to express parental expectations about sexual behavior and relationships. And if you want to learn more about adolescent counseling, I would refer you to these 3 books. The latest book by Dr. M.K. Sinaya has a section on counseling scenarios. We have this latest book released by AHA and IJPP, which has a lot about counseling, and also Dr. M.K. Sinaya, sir, book on adolescent counseling. It's undergoing a revision, and soon it will be in your hands. So adolescence is an age of vulnerability and opportunity. Counseling adolescence is an art and science. It is effective to overcome mental distress, motivate for behavior change, and nurture mental wellness. Privacy, confidentiality, empathy, exclusive time, non-judgmental attitude are important prerequisites. We must remember to partner with adolescents themselves, parents, teachers, and mental health professionals, and refer cases beyond our expertise. Please remember, whatever you may do, even if you're not able to help, make them feel good, make them feel hopeful, because people will never forget how you made them feel. Seek first to understand, then to be understood. Don't rush to judge. And alone we can do so little, together we can do so much. Thank you very much for giving me this opportunity to share my thoughts on adolescent counsel.
Thank you so much, ma'am. It was a wonderful session, and what a wonderful way to start this year with the basics of counseling, which are very like for your the crisp points, and it was such an extensive like your session. So, who else could have given the justice to this topic other than the one who is the author behind different multiple and international and national publications, as well as different members of national international bodies. So, thank you again, ma'am, for your wonderful session. We will take the questions at the end, ma'am, after Dr. Atul Kanikar sir's session. So now we would like to welcome our next speaker, Dr. Atul M. Kanikar. He is the counselor for childhood and teenage behavioral problems for last 18 years with above 350 parenting workshops, 600 school college programs, and 40 innovative workshops. He is a faculty of national international conferences.
Dr. Shilpi, how much time do I have?
So 25 minutes.
Yes.
Are you sure?
Yes.
Yes, sir.
Yes, no, Shilpi?
Yes, sir. Yes, sir.
I thought
Yes,
it
ma'am.
was till 9:30. I was just looking at the watch.
No, sir, we can extend, ma'am, sir.
Okay. Let people have their dinner. Okay, there is no need for any formal introduction. It's okay. Can we start? Because I'm really...
Please, sir. Please.
Yes,
please.
ma'am. Yes.
Because I think people are not interested in what you do, but what you speak. Before I actually start, I want to really congratulate my dear friend Dr. Preeti for an excellent presentation, and she has really got the substance of counseling because she is doing a lot of counseling herself. I have to congratulate all the dignitaries, and with the permission of my chairperson, Dr. Geeta Patil Madam, who has taken a leap, big leap in the field of adolescent health academy, and I have to really take her permission before I share my screen. Should I?
Yes, sir.
Okay. Oh, there's some problem. There is some problem with
So you have to go to share screen.
Yeah.
Yes, sir.
Welcome back. Anyway, let us start the topic without our
Stop sharing and again you can share. Just try.
Probably.
Stop sharing.
okay.
Again you can try.
Yeah, just open your presentation. It's not open.
Yeah, that is what it's not open. That is the problem. But this welcome back screen is not going. CC cleaner.
So would you
So-
like to rejoin, sir, if
So
that
have
works?
you opened your presentation? So have you opened
No,
your
I have
presentation?
not. I have not actually.
So please, no, you have to open your presentation. Then you click on share screen and then bring the cursor on the presentation.
No, the thing is, this CC cleaner has come up somehow, and that is not moving. Anyway, let us do one thing. Let me try once more. Otherwise, we'll talk without slides. No problem. Okay. Basically, what I want to say is.
Then you can share your presentation with someone else so that that person can run it for you.
No, it's okay. It's okay. I
You,
can talk
you
without
send to Silpi, sir, or me. Send to
No,
Silpi or me.
the thing is, it is on my laptop only. It's not in the email. I can't forward it. Should I, for the time being, log out and then again log in?
Yes, sir. You can carry on, sir. Till that time, we'll take the
Questions,
which
yeah.
is asked
Yeah,
to Dr.
please
Preeti.
carry on with Preeti, madam.
So there is a question for Preeti. I think in this case scenario of Reena, do we share with the parents about her exposure to sexual relationship? Does it breach confidentiality? I think very important question.
Yeah, that's a great question. As you can see that she was 17 years old, right? But see, what she's asking is that he is wanting me to have physical intimacy. She's not saying that he has forced her or there is physical intimacy, right? So you can definitely, talk to her about revealing her friendship with this particular boy by probably introducing him as a friend so that the parents are familiar with him. As we often say that you should know the friends of your child. But in this case, from the information that is available right now, there is no breach of confidentiality is not really required in this particular case as things stand now. And I think again and again, we must remember to document, that this is what she said. Because later, if suppose she comes with some other problem, she gets pregnant or something, then they would say, oh, she talked to you. But then you can definitely document and write that what exactly she talked to you. I think that's important.
Okay. Are there
If
any
you
questions?
don't take a notice, does it come under POXO? That it is a mandatory for us to inform about the POXO.
What is the age of the child?
She's 17 years old, and she just, somebody asked you, can I want to be intimate with you. Just asking per se.
That need not be.
Need not be.
As you told, documentation is required, but if it would have been forced and you would not have documented, and if some problem comes, what is
what she told you at that particular time, you can document. If that problem comes, is the next, it is when she talked to you, this was what and this is what you told her.
Geeta Patil madam, she has just said that this fellow has tried to force, but he has not actually done it. So you have to document that the friend said and forced her, but she refused. So that doesn't need any POXO intervention here.
No, that means documentation is very important. Sir,
Exactly.
I think, are you able to share the screens? And I think Neelam Mohan madam has mentioned that psychosomatic problems are increasing, obviously. Everyone knows. Sir, Atul Kanikar.
In whom, AHA members or in adolescents or parents or like?
What,
At
sir?
what level the psychosocial problems are increasing?
Psychosomatic, sir.
Yeah. Even in us. Shall I share my screen?
Yes, sir.
Okay. So, yeah, here it is. Okay. So, I think we have lost a lot of time on this. Basically, this is a very, very brief introduction to rational emotive behavior therapy. we need hours to talk about this, but basically this is a crux of all the psychosocial theories and therapeutic interventions which have been mentioned in the history of psychology, right from Simon Freud, who mentioned about defense mechanisms and unconscious motives and all that. Carl Rogers, Preeti has already mentioned about humanistic approach and all that. Skinner was the person who allotted homework assignments and operant conditioning uh, for the clients. Alfred Adler was the person who recognized, who signified the importance of cognition, that is thought, thinking process in the behavior and emotions of a person. And Dean Piaget was the constructivist who said we are all born with the innate tendency to come out of the problem, whether it is COVID, whether it is tsunami, whether it is any misfortune. We have an innate tendency, a beautiful gift of God, that we come above the situation and we still rise above the problem. And we are that way. Everybody is rather resilient to some extent. And this fellow Albert Ellis in 1950, he combined all these theories, including the Stoic Greek philosopher Epictetus and Gautam Buddha, who mentioned that we have our destiny in our hands, and it is our thinking process that matters a lot. So he combined all these theories of these great people and initially named it as rational therapy. Then suddenly there was some finding in his own clients that there was a lot of emotional problem in the clients. So he made it RT to RET, rational emotive therapy, and ultimately he concluded that ultimately it reflects on the client's behavior. So he made it REBT, rational emotive behavior therapy. So this is the history of the situation. Why it is so much suitable for teenagers is we all know that teenagers have a lot of intelligence. They are smarter. Even our parents mention that आजकल के बच्चे बहुत ज़्यादा smart हो गए and all that. The main thing is our core beliefs and our personality take shape in these tender years of 10 to 18 years of age. And various tools, and one of the most important tools that we use in RABT is disputation or confrontation, argumentation. That is something these teenagers like, especially in the early and middle teenage. So what Preeti mentioned in her counseling process also depends on the age of the child. The same thing cannot work for a 18-year-old or 17-year-old, which works for a 13, 14-year-old. So it depends on but the tools are so much adolescent friendly that it has really helped us in our counseling processes. And the most common issues that we face in our clinical practice are depression, guilt, and anxiety, which are very common in today's teenagers. We can also include stress-related other conditions. Even today, I saw one case where I smelled psychosis, bipolar. And then, as Preeti mentioned, that we have limitations for counseling. We need early referrals and timely referrals. So I had to have a psychiatrist consultation. But these three things, depression, guilt, and anxiety. Depression because of a lot of incompetencies that they have. Plus, there are some genetic factors in depression. Most of the times we see that 50% parents, especially the mothers, also have depressive symptoms. Guilt because they do a lot of something which the parents or the society doesn't like smoking or drug abuse or sexual experimentation. So they carry a lot of guilt. And anxiety because of the mainly academic stress. So they get into a lot of troubles because of that. But these are the things which are very, very effectively managed by REBT. Now, Albert Ellis mentions that we have different types of musts here. One thing is inferential must. Because it is cold in Nasik, it could be colder in all the other parts of India. Simple as that. In Nasik, we have 9 degrees today. Politeness is something if I go to, say, Bangalore, Preeti invites me for dinner, so if she comes to Nasik, I should invite her for dinner or whatever. Conditional musts are like if I have a good lifestyle, I have quit smoking, I do exercise, I have a balanced diet, I may live a little better. Or if I study better, if I focus on my academics, I attend classes, I do my homework, I may excel in my exam. These are all conditional musts. What Ellis mentioned is the absolutistic must. These are all his coined terms. These are not the words in the dictionary. Absolutistic must, like it has to be, it ought to be, it cannot be without this. That type of demands, grandiose demands, the grandiose demands kill our happiness. So when, for example, a mother says, my child has to become an IAS officer, although the child may be average. What happens, the child, okay, no problem. The mother gets all sorts of problems. So these types of grandiose demands, they tend to kill our happiness. For example, all these three things, thinking, feeling, and behavior, they are all interlinked. There is a connection that my class teacher has asked me to introduce the chief guest at the annual social event. Now, look at the pink part, the thinking part. If the child is, unnecessarily stressed up because of this particular task allotted to the child can have a feeling of being stressed up, and actually the behavior can be of trembling on the stage, stuttering, forgetting words and all that. But if the child feels that yes, this is a good opportunity, I can prove that I am a good student, I am a good orator, the feeling could be like a confident feeling of confidence, and the behavior could be the child may actually learn about the chief guest, the introductory part, rehearse in front of the mirror, and the behavior could be really fantastic on stage. So, second example, for example, my life is ruined because my good for nothing husband, I'm not talking about the common people, but my good for nothing husband and child failed to understand me. With this, many mothers come to our clinics. मुझे मत बताओ सर, इनको बताओ, इनको समझाओ. That type of reaction. So here, the mother feels like she is left out. She feels sad, okay, and she thinks she is not a good wife or good mother or good parent or whatever. And the behavior is exactly the opposite. She gets more angry on the husband, more angry on the child, and that aggravates the problem. So ultimately, it reflects on the goal or ultimate outcome. Third thing is, my selfies on bike at high speed are cool. Many teenagers we see, they love to take these high risk behaviors, and road unsafe behaviors are very common. So here the behavior is very high risk. The boy or the girl may feel that this is the best way to impress the opposite sex, okay, and the child or the teenager or the youth may think that this is more, I should improve on my speed to impress other people. So basically what Ellis said is thinking, feeling, and behavior are all interlinked. If we are entangled in one particular circle, it reflects on the other two circles. That is what he said. Now, the aim of any therapy, any process, any counseling process, or any therapeutic process is to convert the unhealthy negative emotions into healthy negative emotions. Now, healthy negative emotions are essential and they improve our performance, our caliber, our progress. Okay, for example, if I have an exam ahead after maybe a month or two, I should have concern that मेरा ये topic नहीं हुआ है, I need to prepare more so that I study more. Okay, I focus more. If I lose someone, I should feel sad, if I have a fight with my wife or if I have a fight with my good friend, I should feel sad. And there is no point in getting happy about it. If I have a problem, I should regret. If I do something wrong, I should take it over. Sorry, I should not have done this. Okay. And same thing with disappointment. If I lose my doggy, recently it happened. I cried that day. Okay. So that because the doggy was attached to me for maybe 10, 15 years. If I am annoyed with someone, somebody tries to give me a cut on the road, okay, on the wrong side, and then still shouts at me. I should have healthy anger, but not that I stab him or I kick him or I abuse him verbally. Okay. If I find that Preeti Galagali is going international nowadays, so I should work more to get focused on my own preparations and capacities rather than defaming her, spreading rumors. Preeti ka bahut connection hai upar tak and all that. So that's a healthy jealousy. Versus what happens in unhealthy jealousy is I am so much stressed up about my examination that I forget everything while the paper is on. And then if I lose someone, it's okay to become sad, but not to get depressed. Or if my child fails in the examination, it's okay to be sad, but not to be depressed. And then regret should not be a guilt. मैंने क्यों किया, मैंने करना ही नहीं चाहिए था. All the time thinking about that. And then healthy anger is I should not stab the other person who has come from the wrong side and tried to kick me or something. And if my neighbor buys a Mercedes Benz, healthy jealousy would be okay. I'll try to improve on my own car rather than putting a scratch on his new Mercedes Benz. That becomes unhealthy jealousy. So when the client comes to us in our clinic, usually they come with unhealthy negative emotions. And through the counseling process, through the therapeutic process, our task is to convert these unhealthy negative emotions into healthy negative emotions. We don't want to eliminate these negative emotions because Ellis says that healthy negative emotions are okay and may be essential for our own existence and progress. So how something appears is always a matter of perspective. Shilpi madam, please tell me 2-3 minutes before we have the time slot available. Okay.
Sure, sir. No problem, sir. We'll
Okay.
have to
So,
listen to it.
from which direction the light is thrown on a particular object will tell us what type of object that is. So, our own perspective will decide how the object is. Same thing happens to a life incident also. Now, reactions to an event may vary from person to person. Let us say COVID, for example. We all went through that. We went through hell, actually. Some people went through paradise also. So whether it is an extrinsic event like COVID, but Ellis also mentions that more than 70% adversities are self-created. We groom them, we incubate them in our minds, and then we tend to think about them. Typically happens in the old age. We see our oldies talking about old times and getting annoyed all necessary. Very much possible as we grow old. But many times we, ruminate things, we remember things, and then we get unduly affected by them, typically called as PTSD. So, if you take COVID as a pandemic, as a adversity or untoward episode that you never wanted, some of us were angry that these Chinese people, let us ban the Chinese products and all that. There was a lot of epidemic of anger, or rather parallel pandemic of anger amongst population. ये सब गलत हुआ, ऐसा होना ही नहीं चाहिए था. We were anxious that my child may not should not have this particular infection. We were anxious that my aging parents may catch it and then there could be a problem. Many of us went to COVID wards and then we sometimes brought the infection home and then we were guilty. मेरी वजह से my parents had to suffer, my children had to suffer. We were sad because we lost some of our near and dear ones. But look at the intensivists and the physicians and the ICU people and the COVID hospital people, private setup especially. who bought brand new fantastic cars and made a lot of fun during COVID, because all the wards and hospitals and intensive care units were full. Look at the oxygen suppliers, look at the pharmaceuticals, remdesivir people. They earned crores and millions of rupees during that. So the same event of COVID can have different types of reactions from different people. That is the whole intention. So basically, Ellis says that A does not lead to consequence. These are all consequences: anger, anxious, guilt, sad, happy. But A does act as a trigger. It's not because I pushed the button that the lights went on. The main reason was the electricity. The button was just a trigger. That is what Ellis says. Now, the typical model here is adversity leads to consequences, but in between comes the burden, the bundle, the baggage of belief system that we carry. And the main focus of cognition is on the belief system. That is, the REBT is on belief system. Some of them are rational beliefs, some of them are irrational beliefs. So what happens is, in emotional disturbance, the A is multiplied by B. It's multiplied by B, leading to the consequences. These are again exponential. And the consequences could be emotional, could be behavioral, could reflect on your personality, will affect your lifestyle, and definitely alter your destiny. So main focus is on the multiplication of A into B is equal to C. And we, through our therapeutic process or through our counseling process, we puncture this balloon, this baggage, this bundle of irrational beliefs, which multiplies the consequences, that is C, reflecting on all the aspects of life. So this is the main aim of rational emotive behavior. So our basically wrong beliefs impede our goal achievement, and belief is an idea which we think as true. I believe that people should follow traffic rules, people should not spit on the road, parents should look after their children, give them quality time, husband should come home earlier than expected. Okay. And uh, children should be kept away from mobile phones. These are all my beliefs. Other people may not believe in what I believe. So that is my idea that I think is true. So basically what happens is, when this belief system gets disproportionately exaggerated, then any adversity, that is A, whether it is intrinsic or extrinsic adversity, that belief system and self-talk, what we tell to ourselves. Right now I am talking to myself, you are talking to yourself, and we are talking to each other. That self-talk is very important, which is mainly governed by the belief system that can be hereditarily born, the parenting styles, the political will, our peer group, everything comes into picture, our own experiences, past and previous. So this self-talk is very important, and the main focus is to detect this self-talk in the client's mind. Am I talking too much complicated? Am I? No, it's okay. Basically, this A is, exponentiated, triggered, ignited by the self-talk, leading into consequences which could be unhealthy. Okay. What we do is, disputation is the main tool, that is confrontation, questioning, sort of challenging what the client is trying to say. And there are some other tools also, which I'll come to later on. ABCD leads to, if your disputation and other tools are successful, the client has effective new philosophy, that is E, and a new set of feelings. And as Preeti concluded in her final statement, that the client should feel better after spending time with us. So a new set of feeling is something very important. But in this therapeutic process, we always start with G. So when the child or a teenager or a parent walks into our clinic, we ask the child, what is your goal? In spite of all these problems, what do you wish to achieve? And then we remove all the things which hamper the attainment of that particular goal through this particular question. And the child or the teenager, many times realizes, yes, यार मेरे गोल के और मेरे बीच में ये मेरा बीच का दिमाग आ रहा था. And once you remove that particular, cobweb, suddenly things become clear for the child to reach to that particular goal. So we always start with G, but remember that our self-talk, or when the child says or talks about some feelings or emotions, or as Preeti mentioned, that open-ended question, descriptive, you must always listen to what the child was telling to herself or himself when the child actually suffered that particular event. And the self-talk is very, very essential. It is the counselor who has to detect that particular self-talk. And then make a list of these irrational beliefs depending on the self-talk. Inform the child that maybe you thought that you were angry, you wanted to smash that particular person. And the child means, yes, I wanted to smash. That type of self-talk has to be detected by us first. Now, Ellis has clearly described that all of us, most of us, I would say all of us, carry these types of beliefs, 3 types of categories. These are all irrational beliefs. Majority of us belong to this particular red group. I must be perfect.
Sorry to interrupt, sir. Sir, 5 more minutes we have, if we can.
I think maybe I'll just find madam. I think I'll stop sharing my screen because this time is too short for the statement.
Ma'am, sir, it was very wonderful to listen to you, but again, we will love to hear from you again if it can be divided into 2 parts again in some.
What I would say is, madam, it's a very big topic, very difficult to complete in 20 minutes, and so that. But if I have 5 minutes, maybe okay, I can go with a case and then we conclude. Okay, is that okay?
Sure, sir.
Okay.
But
now this child had come to me that she is 15 years old, says that she has actually enjoyed physical intimacies with 3 exciting boys so far, just to know whether they will always emotionally support and understand her feelings. It's a very common story, okay, which they should, because she is giving everything. They should understand her and understand her emotions. And her affluent parents often have conflicts within them. Tina now believes that all the boys and men are after money and sexual gratifications only. And she'll be happy all alone because family life is always boring and creates problems. This is what this particular girl, I of course changed the name of the girl, but she said, कि क्या फर्क पड़ता है अभी? I don't want. All boys and men are like that. I have tried to please 3 boys, but they were all useless. They turned out to be useless. Okay. So basically, these are the important things which I jotted down. That she's just 15 years. Okay, that puts me in this POXO business. But she actually enjoyed. There are some abused girls also who mentioned that they actually enjoyed that particular event of abuse, that particular episode, later on to regret about it. But that, hormonal, whatever physical attraction that appears was always enjoyable. And then just to know whether they will always, these are the words that we need to highlight. Always, never, should, must, ought to, absolutely. These are the types of words we have to underline. And all the boys, depending on just 3 episodes so far, all the boys and men are after money and sexual gratification only. There are no men and boys who need emotional support also. And just by her affluent parents who have been conflicting all the time, family life is always boring and creates problems. So these are the words which we need to highlight when she is talking to you. So these are the relational beliefs and the disputation which I had to ask her. Physical intimacies will help me to win emotional support from boys. My question was, who will be at risk and how? Okay. As we all know, there are physical, mental, and social consequences more for the girls. So my question was, who will be at risk and how? Second thing was, you always need other people's support. So my disputation was, how does a newly hatched baby turtle approach sea? Who takes it to the sea? Baby only goes to the sea, no? Crawling. Others should always understand our feelings. Did you ever ask your parents about their stresses? That was my disputation. All boys and men look only for physical pleasures, was her statement. How can you conclude this just because of 3 relationships which you actually enjoyed? You sometimes have to put the pressure back on the child because they're in a fighting mode. Okay. And then I'll always be happy without friends and pleasure. So, how many people do you know who are enjoying life because they have no friends and pleasures? So, most of these questions they puncture that big balloon, big belief system, irrational belief system that the child is carrying. So the corrected version here is I need to be more careful next time when I wish to have a relationship. So self-reliance and safe sex practices. No one but myself will protect me from physical, mental, and social agonies. Okay, which I had before because she had 3 relationships which are broken. So there is enhanced self-confidence and sense of responsibility. I also need to contribute actively for my family's well-being. So there is empathy towards parental stresses and improve family connect, which is the most important protective factor for a teenager's well-being. And I'll try not to overgeneralize people or situation henceforth on its face value, that is insight and maturity. So this is how we tend to, question. It comes with practice, and definitely it helps. So what I would do is now my time is up, so I will stop sharing my screen, and we can conclude. Thank you so much.
Thank you so much, sir. Is there any questions from the delegates?
I really doubt in this short session there could be any questions,
But it was a wonderful session, sir, and we would again love to hear from you
Absolutely.
in future sessions. So over to you, Ashim Ghosh, sir.
I think it's already late, so we should conclude.
I thank all of you, the esteemed speakers, the luminaries who came and graced this occasion, all the people who came on the digital platform. And we've scored a century today, just by the way, who joined and made this such a huge success. Thank you so much, everyone. Thank you. Thank you.
Bye.
Thank you. Good night.
Good night.